all hear me? All right. Thank you so much for coming today. We have a very, very special ceremony for all the Navy staff who was here helping Baton Rouge and Louisiana. With us, we have several honor guests that I want to introduce. Lieutenant General Laura Richardson, thank you so much for coming back to visit us. Governor Edwards, thank you for being here. Thank you so much for your support of the state of Baton Rouge and of Baton Rouge General at Mid-City. Mayor Sharon Westernbroom, welcome back. Thank you again for your support and your leadership. GOSIP Director James Wascom is here. Thank you again for your support. And of course, the most important guests here are 104 sailors who helped us take care of our patients during this crisis. So last time we got together, we had about 40 hearts behind us. And you recall that each of these hearts represents a patient who we discharged from this hospital. We have about 300 of those hearts today, and together with the hearts that we have at our other hospital, the Baton Rouge General and the Navy team took care of over 600 COVID patients. Thank you again so much for your support. I'd like to ask James Wascom to come up, and he's going to have a small token of appreciation. Thank you.
Thank you, Edgardo. First of all, let me just say that as the Director of the Governor's Office of Homeland Security and Emergency Preparedness, we're the agency responsible for coordinating the response for things such as the COVID-19 pandemic. And you hear a lot of terms bandied about, specifically whole of government, total force. If you want to see a definition of that, you look no further than the hallway back here, and to my right, Captain Brown and your team, sir. This thing has been, as far as I'm concerned, a seamless operation. They melded here with Edgardo, with your fantastic team, and actually stood something up that didn't exist before. And as Edgardo said very eloquently, took care of over 600 patients here. And so, Captain Brown, if I can have you come up here, kind of close, but not too close, yes, for social distancing purposes. So basically, we just wanted to display our appreciation in the form of a State of Louisiana Governor's Office of Homeland Security and Emergency Preparedness certificate of appreciation. And hopefully you can, we didn't frame it for you, but you can find a frame suitable for posting it in your headquarters somewhere in Jacksonville. Yes, and basically it reads, Task Force Expeditionary Medical Facility, EMF Mike, is hereby presented a certificate of appreciation for honorable and faithful service in support of the state of Louisiana during the COVID-19 pandemic response to save lives and alleviate suffering for the citizens of Louisiana. Awarded this 29th day of May in the year 2020, signed by yours truly. So, Captain, I really appreciate you guys. We can do a quick photo op if you like. Thank you, sir.
Mask smile.
All right, that's it. So, Edgardo, I'll turn it over back to you, sir. Thank you.
Thank you, and I'd like to introduce now Governor Edwards. This would not have been possible without his support, so he has a few words of encouragement to share with us. Thank you.
Thank you, Edgardo.
Good morning, everybody, and thank you for being here. General Richardson, it is a tremendous privilege to welcome you back to Baton Rouge and to Louisiana. Thank you so much for coming back, and thank you, Captain Brown, and the entire team. I believe it's been 104 members of the Navy who have come in to really help us and when it was extremely needed. The situation, quite frankly, was dire a couple of months ago. And I will tell you, we were sitting there with the highest growth rate anywhere in the country in cases. The fastest growth rate anywhere in the country, and by some calculations, anywhere in the world. And Colonel Wascom and I are there with our team, and we're trying to figure out, okay, we know we have to slow the spread, and we have to surge our capacity for healthcare. And that means you have to have more beds, more ventilators. And then we said, well, even if we can do that, where are we going to get our staff? Because unlike a tornado or a hurricane, when those natural disasters hit, all the rest of the country and the federal government, they are focused squarely on Louisiana, and they can come help. Well, the entire country was going through this same public health emergency at the same time. Their needs were the same as ours, and we quite frankly didn't know where we would get help from. But when it comes to surging your capacity and increasing the number of beds that you can treat patients in, and the ventilators and so forth, there's not a better facility to do that anywhere in the country probably than right here at Baton Rouge General Mid-City. So this facility was best. But that still left us a staffing problem. And Captain Brown and his sailors came in, and I will tell you, there's not a better set of doctors and nurses and professionals to come in and help with the staffing situation than the 104 members that we got from the U.S. Navy. So thank you so very much. So in short, I will tell you that from a facility perspective and a staffing perspective, there probably is not a finer operation that was stood up for COVID patients than right here in Baton Rouge, Louisiana, and I am so proud of each and every person who helped to make that possible. Edgardo, your team has been just tremendous. And these, you know, every day when we update the numbers about the new cases, the new deaths, the new hospitalizations and so forth, what I try periodically to do is remind people these are not numbers, these are people. These are our brothers and sisters, and these all come from families. They're somebody's mother or father or grandparent, aunt, uncle, child, whatever. And so when you see these hearts on the wall behind me, I think last time we were here there were about 40 on the wall. Today there are 300 or so. Those are real live human beings whose families have been enriched because of the services that have been provided here. And so I just don't want people to lose sight of that. And I suspect that you healthcare professionals who actually touch these people, you never will. But I wanted to pause just for a moment and make sure that everybody is fully cognizant and thinking about the fact that these are our brothers and sisters whose lives have been saved here. And quite frankly, there were some whose lives couldn't be saved. But we know they got the very best care possible. And we know that the professional people who were rendering that care gave a lot of peace and comfort to the family members of those individuals who did not make it through. So Louisiana is in a much better place today with respect to COVID-19, with respect to the rate of spread, the hospitalizations, which the death rate is, you know, anytime you announce 18 or 21, you know, we're somewhere in that range every day. That's still an awful toll that's being taken out on the state. But we're so much better off than we were because of the professionals that have been rendering health care. And I've said it at the beginning, and I've said it every day since. The real heroes in this public health emergency have been the healthcare professionals. The doctors, the nurses, the respiratory therapists, the EMTs, the paramedics, everybody. And once you start naming specific groups, you get in trouble because I know that there's about 10 groups or so represented here today that I didn't mention, but it's the entire team. You all have been tremendous heroes, selfless, working, and I just want to thank you so much on behalf of the entire state of Louisiana. I do hope that those of you who are going to be leaving will find an opportunity to come back when we're not in a public health emergency and enjoy more of what Louisiana and Baton Rouge has to offer. And please know that you are always welcome here. As Edgardo said, I'm going to have to leave and get back to the Capitol. We are at the very end of a legislative session, and anyway, there's a lot going on over there across town, and I've got to get back. But General Richardson, please know the state of Louisiana is eternally grateful for the work done here by all of these Navy heroes. And I mentioned this the first time. As a West Point graduate, it is hard for me to say something good about Navy people. Actually, that used to be the case. That is no longer the case, and I want you to know you've converted this West Point graduate. God bless each and every one of you. Thank you so much.
Thank you, Governor. You know, during orientation, I had the chance to speak with all the sailors that came on board, and I gave them basically a 2-minute orientation of my usual, 30-minute session for new employees. And I told them that what people are going to remember after your stay of work here at the General is not so much the technical skills that we all know you had, the quality of the care that you provided, but the emotional connection that you are going to make with those families, with your coworkers at the General, with each other, and especially with your patients. And I have to say that this group of men and women delivered. And I want to read you a letter that we got from a patient's daughter, and I'd like to share that with you. So if you just bear with me for just a moment. My mother, Leona Efferson, was blessed with a compassionate nurse and caregiver named Jonathan. She was apparently declining fast, and he called me so I could video chat with her while she was still able to be a bit responsive. He gave me a chance to talk with my mom one last time, knowing she could understand me. Later that morning, after we made the decision to move her to hospice, Jonathan took the time to make a quick call to me to make sure I was okay. I want you guys to know you have a true hero there. If you guys by some chance can get this to Jonathan, I would like to say this. Jonathan, you are my hero. Please know you gave a cherished daughter a last chance to tell Mama, I love you. Please know you will forever hold a place in my heart for this gift. God bless you. I want to also tell Jonathan and all of you that this is just one small example of things and interactions that happen on a daily basis with your patients, and that we will never forget the help and the assistance that you gave the people of Baton Rouge and the people of the state of Louisiana. Thank you to you, Jonathan. You are a hero, along with all of your friends and all of your co-workers at the General and at the Navy. Thank you very much. I would like, big round of applause. While I'm just singling out one person, one Navy person, it's really you're an example of everything that happened with all of you here. So thank you so much. I would like to present General Richardson and Captain Kevin Brown a small token of our appreciation. And what I have here is a miniature version of one of our hearts back there that hopefully you'll cherish for the rest of your career. Thank you so much. And I'd like to ask General Richardson to share a few remarks with us.
Okay, well, good morning. Governor, thank you very much, and Mayor, thank you so much, Jim, Edgardo, and the whole hospital staff that's here today. Awesome. Let's give you all a round of applause. So we just did a fantastic award ceremony right before this for all the Navy sailors, and I would just want to recognize your Adjutant General, the Adjutant General for the state of Louisiana, and that's Brigadier General Keith Waddell. So Keith, please, there's Keith right there. Raise your hand, Keith. When we first got to the state of Louisiana and began the coordination to bring medical capability here from the active component military, we had the warmest welcome from Keith, and just tremendous. It was just like the red carpet. You couldn't have asked for any more of a warm welcome from a state, and so I just really want to thank Keith for that. And then under the dual status commander, Brigadier General Lee Hopkins, our sailors worked and were under that. His command and control leadership for me for the Title X forces, and so I want to recognize Lee as well. So let's give Lee a big round of applause. We've certainly learned a lot of things, and rest assured that U.S. Northern Command is ready to take care of disasters and disaster responses employing the active component military for you. So if it's a hurricane or if it's a flood or whatever, we're normally the ones that go away to another place to do our business as the active component military. But then when our country needs us and states might be overwhelmed and need a certain capability, then that's when we get called upon to help come in and shore up whatever gaps that you might have in your states. And so we were able to do that. In this capability, as the Joint Force Land Component Command under U.S. NORTHCOM, we had about 9,000 people that were actually deployed out across the entire country. Over 3,000 of those 9,000 were medical professionals, and just like the Navy EMF. And all of these sailors, and never did I think in that Land Component Command, I am Army, so I do most of my missions on the land, but I have sailors that were working for me. And I will tell you, just like Governor Edwards said, sailors can work for me anytime. Cool. Really, really proud of their capability. 450 strong is what their unit is capable of. All medical providers that they bring to the table. And we were deploying, we've never had, I was telling them earlier, we have never had all 10 FEMA regions activated at the same time. Normally when I'm dealing with a hurricane, I'll take you back to Hurricane Dorian in September. We had Regions 2 and then also Region 4 of FEMA activated for those two hurricanes, and or for that hurricane, those two regions. And quite honestly, this is something that we just trained for, and never did we ever think that actually the 10 FEMA regions across the entire country would be activated at the same time. So we were deploying medical capability out to Seattle, to Detroit, and we started off with the Navy EMF going to New Orleans and Dallas. We deployed capability. We were running the Javits Center with 2 military hospital centers worth of personnel. Connecticut, New Jersey, the list just went on and on, Massachusetts. It was just incredible. And so, but we quickly learned that instead of going into alternate care facilities, that shoring up the staff inside of a hospital was the better way to go, right? We were finding that there wasn't a lot of overflow from the hospitals into those alternate care facilities. And so we were, with the help of Keith Waddell and Lee Hopkins and the governor, getting them from New Orleans and Dallas here to Baton Rouge. and then you all welcome them in. I'll tell you, it's something else when you bring in other professionals to get them go through the onboarding process, the badging, you know, applying the skill sets to where the capability needs to go inside of a hospital. Those are mega cheetah flips that were done. I mean, a lot of folks were working very hard to integrate that capability as quickly as possible so it could make a difference. And we could have all of those hearts behind me just flourish because of the results of being able to bring this hospital to the capacity that it can really be at. So I just want to thank everybody because really just the warm welcome from the state of Louisiana, from Baton Rouge Mid-City General Hospital, everything that you all do to integrate these sailors so they can be as effective as they can be, you all did that. And I'll tell you, there's nobody that gets the credit. It's just the unity of effort, and it's the team that just bonded together and moved out and made this happen. And again, all these hearts on the wall made that happen. You all made that happen. So thank you very much, and thank you for what you did for them. And we'll never forget the state of Louisiana. Thank you.
All right, so we gave him a warm welcome, and we're going to end with a very warm farewell. So I'm going to ask Mayor Broom to come and share a few words with you, and she's going to lead us in the warm farewell.
Good morning, and thank you, Edgardo. First of all, General Richardson, thank you, and all of the Navy team who has not only supported the state of Louisiana, but specifically right here in the heart of the capital city. We have such gratitude for all that you all have done for us as we've navigated this pandemic. And certainly as we look on the wall and see these hearts, our personal hearts are warmed by what we see, because those hearts represent survivorship. So thank you all for helping us through this. Now, while you all may have been working, our 104 Navy staff may have been working tirelessly during this time, you probably got a little taste of what Louisiana culture is all about. And so one of the parts of the fabric of our culture certainly is food and entertainment. And so with that being said, we've asked a good friend of ours, George Bell, and his friends to join us and help us thank you and celebrate you with some music and with one of our traditions. And if you look to my left here, Edgardo has an umbrella, and that means it's time for a second line. So all you need is a handkerchief, a desire to dance just a little bit, and we'll take it on out. Thank you, thank you, thank you. George, you and your team hit it for us?